Dear colleagues, this is another case of hypermature cataract done in subconjunctival anesthesia, starting with the paracentesis into the clear cornea and then fashioning round capsular axis using the 25 gauge forceps. The patient is very nice and uncooperative, testing every skill of the surgeon, and this is floppy iris that will start getting fluffy, and that's why I prefer to place the incision into the clear cornea and not at the limbus. Starting the phacoemulsification using the trench mode. I fashion a perpendicular trench on a phaco probe in order to be able to bury the sleeve of the phaco needle inside that trench, and using the chopper I'm able to crack the nucleus all the way down to the posterior plate. This is a very leathery, sticky nucleus, but with this long chopper, any nucleus, it's easy to divide. I'm doing lateral chop here, placing the chopper perpendicular to the phaco needle and using the phaco needle as a lever. I'm able to crack the nucleus and start phacoemulsification of this first quadrant. Doing a lot of chops in this shallow anterior chamber to have less ultrasound. You notice the phaco needle that was placed towards the 6 o'clock area, and I was able to bring the quadrant on the middle of the safe zone and further chopping and aspirate these leathery pieces one by one, doing more chops, and in this way the next day the clear cornea will be a guarantee. The floppy iris is starting to get into the side port. I'm using the chopper to release that from the incision and continue with the phacoemulsification. And I'm down to the last part, and furthermore chop that into the smaller and smaller pieces and safely aspirate that outside of the eye. Finishing up the phacoemulsification, I'm noticing a small part of the leathery nucleus that was stuck in the iris stroma, and after this bag cleanup, taking out the last remnants of the cortex, I'm able to have a nice clean bag at the end of phacoemulsification, trying to get that piece out of the iris stroma using the aspiration needle, but I'm not able to release it from the iris, so I use the Grishaber forceps 25 gauge to be able to take that out and have last part of the nucleus out of the eye. You can leave these small pieces if you want, but I prefer to take them out. Using steroid drops, you will not have any inflammation if you if you choose to leave it there. Injecting the IOL, hydrophobic IOL, inside the bag, and then cleaning up the anterior chamber from the last remnants of the viscoelastic, and pushing down the iris into the periphery. I'm breaking the anterior synechiae that you always find in this hypermature cataract, especially if you have iris like this. That's its floppy iris. Injecting an air bubble and subconj antibiotic and anti-inflammatory agent, and that's the end of the case. Thank you for your attention. Hope this will help you in your practice also.